With veterans and veterans' care in focus, this is Around the Point, a podcast of discussion and relevant news about the VA Hudson Valley healthcare system. The VA Hudson Valley serves about 25,000 veterans each year at 2 campuses and 7 community-based outpatient clinics in the area. This podcast is one way of talking to veterans, their families, and other audiences about issues affecting veterans and veteran care in Hudson Valley. Welcome to the inaugural edition of Around the Point, the official podcast of the VA Hudson Valley healthcare system. I'm your host, Jason Tudor, a 21-year Air Force veteran and the Public Affairs Officer for the VA Hudson Valley. Thanks for listening to us wherever you may be today in the Hudson Valley, in your car, on the train, or in the gym. We appreciate that you've taken time to download our podcast, listen in, and discover the myriad ways we care for veterans here. To kick off our podcast series, we could not have asked for a better or more timely guest in Dr. Joseph Amato. Dr. Amato is the Suicide Prevention Coordinator for the VA Hudson Valley and also has those duties on a nationwide level for the VA. You may have seen Dr. Amato in Hip Hop star and Wu-Tang Clan member Raekwon's video for his single 100 Rounds. Dip into the entertainment industry aside, Dr. Amato spent 11 years as a priest with the Diocese of Bridgeport, Connecticut. Following priesthood, he spent 16 years in the Department of Psychiatry in Stamford Hospital in Connecticut. In 2007, he joined the VA and VA Hudson Valley, where he's worked with us and veterans ever since. He received his doctorate in psychology from New York University in 1990 and performed his clinical training at Mercy Hospital and Medical Center in my hometown of San Diego, California, and at the Newington Children's Hospital in Connecticut. We spoke with him about the spotlight that gets shined on the month of September, suicide prevention, and the importance of family and friends in the process, among other things. Now, taped on August 25th at the VA Hudson Valley in Montrose, New York, here's our conversation with Dr. Joseph Amato. Welcome. Thank you for being here with us.
It's a pleasure.
You know, September is an important month, National Suicide Prevention Month, and there's obviously a lot of focus, but for you, it's an everyday focus. So for this month, do you shift into a different gear? What happens different for you over this month than does, say, for the rest of the year?
Well, the designation of the month as National Suicide Prevention Month gives us the opportunity to get out into the community more than we would in the rest of the year, precisely because it's been designated this way. So we'll be out at different places. I know in the Hudson Valley, there's going to be one day we're at the Poughkeepsie Mall, another day we're at the Middletown Mall. We'll be at colleges in the area as well. Mm-hmm. So we'll take every opportunity to sort of ride the wave of information about how we can prevent suicide for veterans and for the general population, and we'll get that word out during the month of September.
During this month, do you find that agencies are wanting to pay more attention to this, or are they gravitating in a better way toward this, or what changes during that month, do you think?
Well, I think generally people are interested certainly in helping out veterans, certainly in helping out veterans of the current conflicts. The young men and women who are coming back from Iraq and Afghanistan, as well as older individuals. So people want to help out. How can they be helpful? By discussing the issue of mental health care, by discussing the issue of suicide risk and who's vulnerable to it, in publicizing the phone number of the Veterans Crisis Line, 1-800-273-8255, and press 1. So as we get that word out, people actually have a tool that they can use if they come across someone who is in distress, and they can call that number and get some guidance on what's the next step to take. The fact that that's concrete, it's not theoretical. It's not making people, mental health providers. It's actually just asking everyday people. If you see something in a veteran that signifies distress, you might consider calling the crisis line and having a discussion with people who are trained in suicide risk assessment and on crisis management, and then getting being the bridge to getting that person some help.
Let's talk on a more granular level. What are you seeing as the trend right now? Are the numbers up? Are the numbers similar? I don't know specifically what the numbers are like in Hudson Valley, but what are you seeing right now?
Well, the issue is there are close to 23 million veterans in the country.
Yeah.
Suicide is a rare event. We do not want to give the impression that veterans everywhere are killing themselves, because that's not the case.
Right.
But it's the kind of an event that we want to avoid in any kind of setting, in the community, in institutions, in schools, in hospitals, because people actually can even be at risk, even though they're in a healthcare environment. So we don't want to give the impression that this is occurring frequently. It is a rare event, but it is an event that we want to prevent if there's means to do that. In terms of, are we seeing trends? The one trend that we can point to that's very favorable is the fact that when Iraq and Afghanistan veterans come to the VA for care, that they do better than their peers, other Iraq and Afghanistan veterans who do not. And that is significant.
Why?
Now, well, one of the things is there are a lot of impediments to the new generation of veterans coming to the VA related just to their developmental stage.
Okay.
They're younger people, generally speaking. That's not to say that older guys and women have not been deployed to Iraq and Afghanistan. We know that,
Right.
If your unit goes, you go with the unit.
Mm-hmm.
But it's the younger individuals who are just not accustomed to keeping doctor's appointments and to seeking health care, because generally speaking, they're healthy.
Well, is that sort of a I'm young, I'm immortal sort of thing that I think I even got as a young airman in the Air Force? I mean, I would think that would be just sort of natural. What do you think?
Yeah, well, when you say I'm young and immortal, really that's sort of that is not a healthy cognition to have about yourself. Mm-hmm. We know that young people are risk takers.
Yeah.
Sometimes they drive fast. Sometimes they use substances which they probably shouldn't. That's not good for their health. So, young people tend to be risk takers. Mm-hmm. And we've all benefited from their ability to take those risks because they enlisted in military service, mm-hmm. which is in and of itself a risk. People are putting their lives on the line. Mm-hmm. So these young people are accustomed to seeing themselves as invulnerable, or as you mentioned. Mm-hmm. So to get them and to come in for appointments when they have other things to do, other things that they're more interested in.
I would think like work and also would be a barrier as well.
Work and socializing, mm-hmm. and other things. VA has been making progress in having evening hours mm-hmm. and weekend hours in order to accommodate the work schedules of people. Yeah. And that's a good thing. But still, the idea that you'll go to medical appointments is something that just is not in the mindset of, generally speaking, of the new generation of veterans.
Do you think there's a barrier to even people calling this 1-800 number? I mean, do you think there's maybe a better question is what stands in the way of a friend, family member, or a person picking up that phone, dialing the 800 number, pressing 1, getting the help that they need?
Well, I think just their ignorance of what the purpose of the number is.
Okay.
And what I tell people is do not hesitate. Do not second guess yourself. If you see someone having a hard time, you can call the crisis line and you will be guided on what the next move is. Mm-hmm. If necessary, that provider on the other end will take responsibility for the situation and send rescue. Mm-hmm. You tell them someone looks like they're despondent, they're expressing thoughts that they just have, they've run out of steam in terms of managing their problems, they're getting intoxicated frequently and at greater levels than they usually do. Mm-hmm. So you present that to the responder on the other end, and then they'll come up with a decision with you on what next to do. If they have to send rescue, fine. If they just need to arrange for a substance abuse or mental health appointment, they actually can send a consultation request to one of the local SPCs across the country, like myself, and we can follow up, immediately if it's during daytime hours, or follow up first thing the next morning if it's in evening hours when our offices are closed. And we can ensure that the person gets the care they need. So any hesitancy I ask people to overcome, that it's meant for calls. And we know that there have been, as of today, over 1,200,000 calls to the crisis line. It's been in operation since 2007 for veterans, and people are calling. So we encourage them to call.
We've touched on this, but how important are family, friends, and just even coworkers in this process?
Well, one of the indicators of potential elevated suicide risk is when relationships are strained. And, there are experts in the field who have written extensively on this question. So when the relationships are strained, when there's difficulties, when people are not responding to phone calls, when invitations to join family celebrations are refused, that might be an indication that the person is not doing well, and you might want to call the hotline.
You've done this for a long time. You're passionate about it. I've known you for a little more than 3 months. What's the toughest part of your job?
The toughest part of my job has to be with some individuals who ask for help and then refuse the help that's offered. And that's very stressful. The other thing that's difficult for me, even though I'm not a member of the military, I'm not a veteran myself, is that you never know when incoming will occur. So we can be called by other providers, by providers in general medicine. We can be called by family members. We can be called by friends of veterans. We can be called by their family members, and you never know when it's going to come. And sometimes there are multiple calls simultaneously, and we want to answer everything.
Yeah.
We do not want to leave one of these things unattended. So, and it seems, that it's sort of almost like a slogan that it's either feast or famine. And not that it's a feast when people call the hotline, but there are multiple calls or it's quiet. So, and I think this is true for most suicide prevention coordinators. When it's quiet, we wait for the other shoe to drop, so to speak.
No.
We know someone's going to call, that there's going to be events. We know that.
Right.
And we're on the alert, ready to take action when we're called upon.
When you meet with your other suicide prevention professionals who may only deal with the civilian crowd, you tell them the biggest difference between dealing with a vet and dealing with someone who is not a vet is what, or is there a difference?
Well, no. I mean, suicide risk is suicide risk. Veterans have somewhat added risk because of the consequences of their military service. If they've been exposed to those blast waves, as in the current conflicts, if they have a history of post-traumatic stress disorder, if there is, a substance abuse question, so they're at somewhat elevated risk. And, we're concerned about that. But one of the benefits is we have the resources of the VA that is well aware of this. We are now the subject matter experts on the question of suicide prevention, and we have put in place a system to take effective action, and that's a good thing. So although veterans bear the weight of their service in their personal history and their level of risk, they also, the weight of their service is alleviated to some degree by what we've put in place, by the smartest minds in the country.
Sure.
And this is sort of a never-ending commitment to veterans if they contact the hotline, if they reach out to us, we will be there to provide the assistance that's required.
We're releasing this right on the heels in September, September 1st, right around there. And we are, as I mentioned, right on the heels of the holiday season. And I use my air quotes with you in the room. I think some people, think that suicide attempts go up in the holidays, that there's a proclivity for it because of certain things they see. I've heard different things that this is a myth. Can you talk to that a little bit?
Yes, the idea of the holiday blues.
Yes.
That there are more events, that has not been supported as far as I understand. But for those people, for those individuals who are isolated, whose family members may have predeceased them, and particularly if they're at advanced age, so that they're alone during the holidays, that's an added burden. But do we say suicide goes up during the holidays? We can't point to that. The holidays are also a mixed blessing. Being with your family can be a mixed blessing.
Right.
Sometimes when people have to, be with their families, that actually adds more stress. There's family conflicts. Frequently there's alcohol involved. There's old wounds within the family network that may be surfacing at the holiday time. So it like I said, it's a mixed blessing. Generally speaking, being in touch with our families is a good thing. A stable, supportive, loving, caring, not overly intrusive relationship with our parents, with our siblings, is a good thing. But for some individuals, it can be trouble. But it has not been substantiated that the holidays raises the number of incidents. Psychiatric utilization actually goes up in the late winter, early spring. So when there are more events, when emergency rooms are filled with more incidences of depression, of suicide thinking, of suicide attempts, that's actually in the late winter, early spring. Why that is probably too complicated for us even to comprehend here.
Sure.
But that's where the numbers tell us when the risk is greater. But for those people who tend to be lonely and isolated, the holidays becomes a particularly difficult time.
Yeah.
And we want to reach out to people that we know that may be alone. That would be a good thing.
Sure. September is a busy month for you. Can you talk about a few of the events where you'll be, and maybe some of the VA Hudson Valley folks will be there with you?
Yeah, well, as I go through the calendar in my mind, the first event, I'm actually speaking to the regional office of the VA in Hudson Street, the Thursday of the first week, September the 4th, and giving them information on what to recognize in veterans that they're dealing with, and then also how to take action. I'll be at, like I said before, I'll be at the the Middletown Mall on September 6th. I'll be with the military community up at Stewart Air Base on the 7th. That's always a
big event.
And the chief there throws a good party. So I can't wait to go again. And then I'll be at the Galleria in Poughkeepsie. I think it's on the 20th.
Okay.
Senator Gibson in the Hudson Valley is having an event on the 27th. I'll be there. I'm speaking at Lincoln Hospital doing psychiatric grand rounds on the 23rd. So we're going to be
it's a busy month
all over the place.
And that's why I wanted folks to hear. And one more time, please, on the Veterans Service Hotline. Please.
Okay, the crisis hotline number is 1-800-273-8255. And when the call engages, press 1. That will go into the VA network. If you don't press 1, there might be somewhat of a delay, because remember, that crisis line number was established well before the VA jumped on board.
Right.
That 1-800-273-8255 is the suicide prevention hotline for the whole country as well. But when you press 1, it goes into VA, and we are We are like an army of providers who are ready to provide assistance to veterans in distress. So if you call it, you will get an immediate response, but you must press 1.
Dr. Joseph Amato, thanks very much for your time.
I'm delighted to be here. Thank you.
My thanks to Dr. Amato for taking some time this month to talk with us. We'll leave you with the telephone number of the Veterans Crisis Line one last time. It's 1-800-273-8255, and be sure to press 1 to connect with a VA-specific person to help. Thanks for listening, and we'll fill your ears again in about 2 weeks. Thank you for listening to the Around the Point podcast. If you have feedback on this podcast, or if you would like to suggest a topic, we'd love to hear from you. You can find VA Hudson Valley on Facebook, Twitter, and via the VA Hudson Valley's website at www.hudsonvalley.va.gov. You can also call us and leave a message at 914-737-4400 and ask for the Public Affairs Office.